Hello, my name is Natalie Mason and I'll be talking today on plastic surgery. Plastic surgery procedures are being performed on people from all walks of life. In a society focused on looks, one may hastily consider plastic surgery to fix an abnormal nose or just to shed a few unwanted pounds. A little history on plastic surgery. It originated in ancient India, but became more prominent starting with the First World War. Medical professionals started exploring new techniques to treat the wounded and disfigured men at the war. Now, there are two types of plastic surgery. First is the reconstructive surgery. This is performed on abnormal structures of the body caused by congenital defects, developmental abnormalities, trauma, infection, tumors, or diseases. Then you have the one that's mostly used, which is the cosmetic surgery. And this is performed to reshape normal structures of the body in order to improve the patient's appearance and self-esteem. Now, there are different types of procedures for cosmetic as well as reconstructive surgery. You have the liposuction, the facelift, the tummy tuck, which is the most dangerous, but ironically is the most requested surgery. You have the permanent makeup, Botox, breast reduction, breast reconstruction, the skin cancer. This is mostly found on the face, head, or neck and can be disfiguring. So the purpose of the reconstructive surgery is to remove either all or part of the growths. Then you have, as well as the cleft lip. The cleft lip is a separation in the upper lip. And this is usually performed on children, and a lot of medical professionals are really pushing this particular procedure just because it'll give the child a more healthy, happy, productive life. And then also you have the scar revision procedures. Now, there are positive impacts of having surgery. And most women feel happy because of the renewed body parts. They have positive change of psychological perception of life. Also improvement of self-worth, self-esteem, and quality of life. They become more confident. Studies suggest that most patients were pleased with the outcome and felt better about themselves once they had these surgeries. A lot of these women before the surgeries are very shy and really keep to themselves, but after these procedures are done, they come out of their shyness and they're no longer shy. Also, these women are known to experience less negative body image emotions in social situations such as at work or out with friends. Now, there are some negative outcomes because of plastic surgery. Plastic surgery has become a commonplace in the past few years that many patients do not really think about going into the surgery. They don't consider it to be a surgery just because they're bettering parts. But it is a surgery, and it's something that you really need to think about before going into it. Although plastic surgery is often downplayed in the media, the social, physical, and psychological risks are very dangerous to the person's well-being. Now, patients who have unrealistic expectations of outcomes are most likely to be dissatisfied with cosmetic procedures. Things to consider is your expectations. Anticipate improvement, not perfection. Don't think once you have the procedures that you're going to come out looking like a movie star, because you'll be very dissatisfied with the procedures. Don't count on surgery to save a rocky relationship or gain a promotion or even to improve your social life. Time and expense, you need to consider this because cosmetic surgery isn't covered by health insurance, although reconstructive surgery is. Depending on what it is, the prices can vary between $100 to several thousands of dollars. You also have time off of work because it is a procedure. It is a surgery procedure, so you do need to recover from it. Then there are also potential risks. You can possibly have a stroke, post-operative complications, and even sometimes death. You must be comfortable with the fact that cosmetic surgery, like any surgery, can be a risk to your health, and that the results may not be what you anticipate. Now, there are also some physical changes to consider. Some people have suffered from pneumonia, strokes, heart attacks, blood clots, bleeding. If you suffer from bleeding, then sometimes you may have to have a blood transfusion. Some people have infections, as well as skin breakdown, and this is usually found in people that are smokers. This is a separation from healthy skin caused by poor blood circulation. Other things to consider are psychological changes, and the body dysmorphic disorder, which is BDD. Some of these people are never satisfied with the cosmetic interventions despite good procedural outcomes. These people suffer from the BDD. They obsess about the perceived defect, usually for hours each day. Now, the definition of BDD is the preoccupation with objectivity, absent or minimal disformity that causes clinically significant distress or impairment in social, occupational, or other areas of functioning. People also suffer from post-operative depression, and this depression usually sets in around 3 days after the surgery, when you are regaining some of your physical stamina, but not your post-operation appearance has not yet begun to improve. And a lot of people call the third day blues, and sometimes this can last anywhere from a few days to several days. So that is something that you need to consider. Now, who is at risk? These people should really steer clear of these type of procedures. People who suffer from diabetes, overweight, have lung cancer, have heart conditions. They really need to stay away from these procedures because they can cause complications during the procedures. Now, researchers have come up with a brand new technique that will allow doctors to work plastic surgery miracles using only a patient's own stem cells. Now, stem cells are cells that have the ability to make more of themselves and to differentiate into special types of cells like skin or other tissues. Now, normally stem cells usually come from embryos. However, that is a big controversy with taking the stem cells from the embryos. So now, researchers have found that certain adult stem cells have the same capabilities. Now, these stem cells will actually be grown in a petri dish and then eventually are input into the individual, and they continue to grow and divide and create natural tissues. And if this is something that you can do, then you don't actually have to have these surgery procedures and you don't have all these complications. Now, in conclusion, plastic surgery has become an obsession in America throughout the past decade. Due to the media and other factors, American society seems to hold a ridiculously high standard of appearance that rewards only those who are thin, young, and beautiful. Now, plastic surgery, is it a good thing or a bad thing? You be the judge. Thank you.